Well, I do want to be respectful of everyone's time, so let's get started. Hello again. I'm Alankrita Olson. I'm a preventive medicine physician in Maryland and a board member of Physicians for a National Health Program, or PNHP. And my pronouns are she, her. So if you just joined us, please make sure to introduce yourself in the chat, put your name, location, and why you want private insurance out of Medicaid. For me, I know that Medicaid managed care companies use the same tactics that we have been fighting against, like prior authorizations, to delay and deny care for our most vulnerable populations, all while profiteering off our taxpayer money. So it's high time we get rid of them. So continue to share your stories in the chat. I know many of you already know what PNHP is, but just to make sure anyone new in the webinar gets to begin to learn about us, PNHP is a physician-led nonprofit that has been organizing around and advocating for a single-payer health insurance system in the U.S., or improved Medicare for all, for over 35 years. And we have come so far in that time, from seeing our proposals become bills in Congress to elevating the idea of universal healthcare access within our public discourse. So whether you're a physician, nurse, other healthcare worker, or patient, you probably have an experience that shows why profiteering within our healthcare system is not right. And that's especially true in our healthcare programs, our public healthcare programs like Medicaid, which has seen faster privatization than Medicare, and as a result, worse health outcomes. And now with this administration's healthcare cuts, through the big bad bill, Medicaid patients are facing a crisis. So today we're going to hear about the role that private insurance corporations play in the crisis, how states can play a role in combating this by redirecting millions of dollars from paying these private insurance companies to covering healthcare by cutting out these middlemen, and what you can do about it. Throughout, we will have a Q&A at the bottom of the screen for people to submit their questions, so please feel free to do so as we talk, and we will answer as many as we can. So let's get started by hearing from Amelia from People's Action Institute and Citizen Action of New York on why Medicaid is so important to our health.
Good evening, folks. My name is Amelia, and I'm a member leader with Citizen Action of New York. I'm here today because Medicaid has kept me alive for nearly 20 years. I'm a chronically ill and disabled American, and like many people born disabled or who become disabled at a young age, I've spent most of my life in or near poverty. For people like me, Medicaid is not a safety net. It is the foundation that makes survival possible. It took 32 years for me to receive a diagnosis, cardioneurogenic dysautonomia, because so few doctors understand or treat complex conditions, especially undermanaged care. In those decades, I've had heart surgery, 3 stomach surgeries, endless medical procedures, and weekly blood draws for a bleeding disorder. None of it would have been possible without Medicaid. But I've watched the program change. I've watched access shrink. I've watched care become harder to get. And I've watched private insurance companies take over more and more of Medicaid while putting profits ahead of patients. One of the clearest signs of how much things have changed is something most people never see: ghost networks. On paper, Medicaid managed care plans show pages of in-network doctors, dentists, and specialists. But when you start calling, you find out that most of those providers don't actually take your plan, aren't accepting new patients, or haven't worked with managed care plans in years. The list looks full, but when you need care, the real network is almost empty. And patients like me end up making dozens of calls just to find one person who will see us. My dental care is a perfect example. A medication I was given at 12 permanently damaged my teeth, and by 19, I needed ongoing restorative treatment just to keep them from breaking. When I lost my mother's insurance, I depended completely on Medicaid managed care, and finding a dentist who accepted it was almost impossible. I eventually found one, and I stayed with them for years until they told me they could no longer afford to take my plan. They explained that they still accepted straight Medicaid, but the reimbursement rates under managed care were so low that they were losing money every time they treated a patient like me. This is what privatization looks like in real life. When private insurance companies control Medicaid and Medicare, Care gets harder to find. Approvals take longer. Providers drop out because reimbursement rates fall. The list of doctors and dentists I can actually see shrinks every year. And people like me, people who already struggle to be diagnosed, to be believed, to access care, end up in emergency rooms for basic needs that are often still left unmet. It is the most expensive and least effective way to keep people alive. For me, with the combination of bad genetics, long-term medication side effects, and long periods of lack of access to dental care, my teeth are still in horrible shape. This past August, I finally found a new dentist that would take my current insurance plan after 5 years of searching. I got in and the dentist did a workup and created an entire plan of care that would leave me with a functioning mouth of teeth again. It would take time, patience, and pain, but it would mean an end of breaking teeth and prolonged dental infections. When the office submitted the plan of care to my insurance for approval, it was immediately denied. They even denied the things that would have been covered without issue. Uh, that would have been covered without issue, such as extractions under base Medicaid. Their reasoning? I have too many teeth in my mouth to need such extensive work. Except if they actually bothered to look at the plan of care instead of having AI do the work, they would have noticed that once the broken, dead, or otherwise highly compromised teeth were removed, my number of teeth would meet their standards. My dentist anticipated the denial and is working with me while I work with the People's Action Appeals team to try to get the decision overturned. But in the meantime, I still have an ongoing infection that is above a previously installed bridge that my new dentist can't get to because removing the bridge to fix the problem would require starting the work from the plan of care that the insurance refuses to cover. This infection is now eaten away at the jawbone and is slowly making its way towards my sinus cavity. If the two connect, an already bad situation will become much worse. With my myriad of other health issues, the infection and my current inability to really chew anything harder than a soft, solid state is drastically affecting my well-being. Insurance companies should care about how one issue affects the rest of the health outcomes, but sadly, that's not the truth. Privatized health insurance companies have proven time and again that they will do anything to increase their profit margins. And that includes denying life-altering and even life-saving care to their customers. Because let's be real, that's all we are to them. We're not humans deserving of genuine care and good health. We're consumers of a product that they have to sell. It's time to take back Medicaid from private corporations and return it to what it was meant to be, a public promise that every person, regardless of income, disability, or circumstance, has the right to not just survive, but to thrive, to live with dignity, with stability, and with health.
Thank you so much, Amelia, for that powerful testimony. It really isn't right. Each additional step to getting care, each denial is death by 1,000 cuts and something no one should be facing when you need medical care. And we know that millions of patients are facing the same situation. Now we will hear from medical student Geetha from Florida, who is a leader of Students for a National Health Program, or SNAP, PNHP student organization, to tell us about a recent PNHP study that shows how we can improve health outcomes and save money by getting rid of these insurance middlemen.
Awesome. Thank you very much, Krita. Now, let me confirm that everything is in order. Great. So that was an incredibly moving story from Amelia. And being somewhat on my journey to being a healthcare professional, those stories are really only just too common. So I'm excited to share with you all the results of months of research that PNHP has put in with external experts and a policy committee. They dove deeply into the research into the literature of managed care organizations, which are essentially insurance companies like Cigna, BCBS, United Healthcare, and looked at their impact on Medicaid. And I'm going to be sharing what we found. Now, just as a reminder, for some people who might not, know, Medicaid is the public healthcare option that largely provides for children and people below a certain income level. Estimates put the percentage of US population that is on Medicaid at somewhere between 20 and 25%. So just think about that. That's 1 in 4 or 5 Americans are currently accessing this care or not able to properly access this care. Not to mention the number of people who have been on Medicaid and have received that support and, no longer require it. So there has been an increase in privatization of Medicare. You might know this as Medicare Advantage, where private insurance companies have started taking over the coverage of Medicare. But this problem is actually much worse in Medicaid. And it's the same insurance companies and profiteers that are driving the privatization of Medicare as in Medicaid. Now, I want to point out that this graph only goes to 2022 because we do not have the updated numbers for Medicaid privatization, but we know that Medicare Advantage, the privatized fraction of Medicare, is at 54%. So we can only assume that Medicaid has followed a similar pattern. That's over half of our public healthcare options are actually not public at all, and they're controlled by private companies, but they are being given public dollars. With the 1 trillion Medicaid cut due to the budget reconciliation bill, state budgets are also threatened. We know that rural hospitals are already closing. This is not just urgent for us and our patients, this is also urgent for the states. We have a real opportunity to leverage that pressure that states are under to provide a solution of deprivatizing Medicaid or cutting eligibility, cutting services, cutting reimbursement rates, reducing funding for other state programs, or raising state taxes. And while technically all of these would save the state money, there's only one that would really directly improve healthcare outcomes. Now, this is just some numbers that I don't really want you to look too closely at, but basically, managed care organizations like these insurance companies act as middlemen. They are the ones who are controlling where the public dollars are going for public health care. Now, Milliman is one of the most respected actuarial firms, and this is what the PNHP report based most of their projections on. They looked into where all of this money is going, and they found that there was a medical loss ratio of about 87% over 10 years. Now, medical loss ratio is the actual percentage of money that is going into the delivery of healthcare. So you get a really good look at what insurance companies really think about the actual delivery of healthcare. They view it as a loss. But for our purposes, we can then assume that the inverse, 13%, is how much is actually going towards administration and profits. So we are then able to project the actual savings for states in the nation. 13% savings immediately if we cut out Medicaid, right? But then, there would be a 1 to 2% increase of administrative spending by the state to then cover the loss of administration. And if states did not move to replace any the coordination of care, there might be an increase in utilization of Medicaid resources by about 1%. But that's obviously not what we recommend. We recommend facilitating a full suite of care coordination, improved access to primary care, and there would be a reduction of utilization by about 5% over time, just due to, the the decrease in necessity for expensive emergency care. And so we are left with a net saving of 10% to 17%. Now, we did the projections for all of the states, and this is all in the report. And we encourage you all to go look at this report. But just as a little game, if anybody is here from Florida, we can save $1.3 billion a year. If anyone is from Pennsylvania on this call, you can save $2 billion per year. And if anyone's from New York, you can save $4.4 billion per year. That's a lot of money per year. I'm from Florida, and I know that, there's a lot that I can think of that we should do with $1.3 billion per year. So as a fun, interactive segment, why don't you come up with what you would do if your state got this money and put it in the chat, and we'll pick out some good ones to share. So most states would save hundreds of millions of dollars per year. And all the states combined would save $34 billion per year. Federally, we could save $43 billion per year for a combined total of $77 billion. Just let that sink in. Now, our main focus today has so far been on the financial gains from removing private insurance from Medicaid, but we're all healthcare professionals. At least I'm not a financial analyst, so I really care about the health outcomes of my patients. So let's talk about how Connecticut successfully deprivatized their Medicaid. Connecticut is actually the insurance capital of the world. And so, they were up against a powerful lobby. United Healthcare and Aetna have huge presences there. Connecticut is also a small state. It's a relatively wealthy state, and they had a democratically run House, Senate, and a Democrat in the governor's office when this bill was passed. But they organized and implemented a robust political campaign where they identified state and local legislative cycles that worked with their plan. They then educated all of the Democratic candidates about the failings of managed care organizations, and they waged a public campaign. So these are a couple of the tactics that they used. This secret shopper survey is essentially kind of repeating what Amelia said about ghost networks, proved officially that the access to care that insurance companies advertised was not actually what was available to patients. And so with all of those tactics, Connecticut successfully deprivatized Medicaid in 2012. Now, here's an example of two states. One state, Connecticut, removed managed care in 2012, compared to New Jersey, which still had a majority of privately run Medicaid. Connecticut saw an earlier detection in cancer compared to New Jersey that correlates with the onset of the elimination of managed care in Connecticut. Now, I'm also a graduate student. I'm doing my PhD. I love a control group and an experimental group, but this gets us pretty close to that. Here we have a natural experiment where two states were very similar and had very different health metrics. And this really is important, right? Because the earlier you diagnose cancer, the decrease in mortality that you see. This is genuinely life or death for some patients. Now, our goal with the report was about the finances. So just briefly, Connecticut did deprivatize Medicaid in 2012, and they immediately saw a reduction in spending. And they actually saw over 12 years, they saved $4 billion. Connecticut, which is this tiny little state. saved $4 billion just from removing unnecessary overhead. I just included this because I want to point out that this is a very timely topic. This was an article that I came across 2 days ago, just scrolling on Facebook, the Wall Street Journal calling out the poor role in insurance companies in Medicaid. The time to act on this is now when people are paying attention. We can do this, we have a chance to go to legislature with money and say, here's hundreds of millions of dollars. And with this report, we can promise that it's not going to hurt people and in fact will help people. Plus, I mentioned, Connecticut had a democratically run House, Senate, and governor, but this is truly a bipartisan issue. People of all political affiliations are on Medicaid. Deprivatization saves money and improves outcomes. As I had mentioned in the bigger talk in the PNHP summit that some of you may have attended, this is largely going to have to be a state-by-state initiative, but if we all work together collectively, I really think this is an achievable future. In fact, we're not starting from scratch here. A lot of these strategies and draft bills are up on the PNHP website and in the report. Minnesota is in the process of deprivatizing their Medicaid, and I think Hawaii's bill will also be up soon. So I encourage you to reach out to PNHP or to me if you have any questions on how to get started in your state, and there's my contact information. Thank you.
All right, thank you, Geeta. That was a great presentation, and it's clear that states don't really have many options for dealing with these cuts. They can either raise taxes or cut spending by kicking people off Medicaid or dropping services, which leads to poor health outcomes. So we have substantial leverage here with a solution that actually saves money by removing these unnecessary middlemen. And with so many state legislative elections around the corner, most state legislators and governors are not going to want to go to their constituents and say, we kicked you off Medicaid so we can keep paying United Healthcare. So if we raise this issue loudly and hold our elected officials accountable, you can show your communities how private insurance companies truly serve no purpose, and that is high time we kick them to the curb. Please continue to submit any questions you have in the Q&A, but I'm excited to welcome Kara Sheenan, who is National Nurses United's legislative advocate, to talk to us about how Medicaid cuts are going to impact hospitals.
Thank you, Krita. As Krita said, I'm Kara. I'm on staff with National Nurses United. I'm repping our nation's largest union of registered nurses. Really happy to be here today with you all, but also in the fight with all of these amazing folks and in deprivatizing Medicaid. I wanted to just share the perspective of our members who really see the connection between this fight and winning a single-payer Medicare for all system. So first, I just wanted to share just some stories, a summary of stories that I've heard from our nurse members about what recent Medicaid cuts mean for their work and for their patients. And I'll just start by just saying a little bit more background on our union. We represent 250,000 members. And just like many of you on this call, our nurses see firsthand how the profit-driven healthcare industry negatively impacts patient outcomes and their ability to seek care when they need it. And our nurses, again, along with a lot of folks on this call, have been sounding the alarm and sharing how dangerous Medicaid cuts will be for their patients and for public health. It's not an over-exaggeration when nurses say families will go into medical bankruptcy, people will put off their doctor's visits, people will experience the deaths of their loved ones for preventable and treatable conditions. And honestly, to be frank, our nurses have been seeing this already. Our ICU nurses see patients come in that are rationing their prescriptions, patients who are unable to get treatment and they end up in the ER. But this is all going to go into overdrive when these Medicaid cuts go into effect. And when these cuts go into effect, providers, nurses, healthcare workers are going to be working within a healthcare system on the brink of collapse, doing everything they can to save their patients. There are hundreds of vulnerable hospitals, as we heard, that will likely close without Medicaid funding. And we know that this is going to create a domino effect of consequences our country cannot afford. So our nurses are really behind this. We want to act now to prevent the worst from happening, and we believe the only way forward is to get rid of insurance companies entirely. We're working towards that, and we want to put healthcare access back into the hands of patients and caregivers. So, as I said, we support Medicare for all, but we also are behind the campaign to deprivatize Medicaid. Right now, we all know our healthcare system is so fragmented and the insurance industry is deeply entrenched within it. States that have privatized their Medicare programs are helping to give insurance companies further control of our healthcare delivery systems. But by kicking insurance companies out of state Medicaid programs, not only will we save money and improve patient outcomes, but we will also set up a system that makes so much more sense. States can more easily get payments to providers, and nurses and healthcare workers can focus on the patient. The pathway to Medicare for all is going to be a long and hard fight. We're going to have to detangle the insurance industry from healthcare delivery, and we believe that this campaign to deprivatize Medicaid is such a powerful way to get there. By building up state coalitions to see these campaigns through, by publicly toxifying insurance companies, improving to politicians and the public that they do not care about patients, providers, and nurses, we can really help to build public support for a system that more resembles a single-payer healthcare system. We can build up our base of patients and electeds who support this model. So I'm coming to the end. I shortened my remarks a little bit because I think everyone has really covered some amazing points so far. And I just want to share what a nurse was sharing with me when we were talking about this campaign that could set us up for success for deprivatizing Medicaid in states and getting us closer to a national Medicare for all system. And she said, imagine that we can reverse course from July, that we can live in a reality where astronomical healthcare costs and lack of access are not factors that individuals, families, or businesses have to consider before going to the hospital. Imagine a country where the insurance companies don't profit over our misery and despair while driving thousands into bankruptcy every year. Imagine a country where everybody has equal access to an excellent standard of care. And so we really live by that vision, and we know that it's going to take a while again to get there till every single healthcare provider can live in a Medicare for all system. But we know that by doing the work to dig into these state campaigns that we can get there, and that we can really build, again, a healthcare system that makes sense and that benefits not only patients, but can help make sure that providers and nurses can give the care that they want to give to their patients. So again, thank you for having me, and really excited to be in this fight with you all, and look forward to continuing this work together.
Perfect. Thank you, Kara. As physicians, medical students, and healthcare workers, we see every day the consequences that our profit-driven healthcare system has on our satisfaction at work. We call that moral injury. When we can't treat our patients properly because the insurance corporations are putting profits first, we feel demoralized and distressed. It's so bad that in a survey conducted by PNHP of 1,500 physicians, almost half were considering or have left their jobs because of moral injury. And we know that solution for this is Medicare for all. But we can't get to Medicare for all without first getting these profiteers out of our public healthcare system. And to do that, you need to build power among patients and healthcare professionals to demand that we put care first. So now we'll hear from Emily at Progressive Maryland, an affiliate of People's Action Institute, who will tell us about the campaign that they are planning to cut out the middlemen in their state.
Awesome. Thank you so much. I'm going to go ahead and share my screen. Can everyone see the presentation?
Yep.
Cool. Thank you so much. So again, my name is Emily Leonard. I am a member of Progressive Maryland, and I wanted to share today about reclaiming Maryland Medicaid. This is something that our team at Progressive Maryland is really excited about, and it's going to be a high-level look and a comprehensive look into Progressive Maryland's vision for deprivatizing Medicaid. So I'll go ahead and get started. So who we are. Progressive Maryland is a statewide multi-issue grassroots organization, and we have over 120,000 individual members, supporters, and organizational affiliates statewide, as well as strong relationships in our state legislature. healthcare justice in our organization and in so many is a priority. And what we do is we focus on regional, state, and national healthcare justice issues. So this issue is a statewide issue for us. And some of the things that we've done thus far in recent years is we've held Republicans accountable for the deadly 2025 federal budget cuts. And the team recently focused on a grassroots petition campaign targeting Representative Andy Harris and MD1, and recently delivered thousands of signatures on a petition to ask him to hold a town hall to explain why he got behind those cuts to Medicaid. Progressive Maryland, we advocate for national reform, including the 2025 Medicare for All Act. And recently we had a great victory. We've been pushing for Senator Van Hollen to co-sponsor the Medicare for All Act, and he just verbally agreed to do so. So that's really exciting. And then we've been winning policy change in Maryland. During our last legislative session, we helped pass breakthrough measures that made it easier for patients to appeal and fight unjust claim denials, to launch a state investigation into insurer practices and rising denials, and establish rules to rein in AI and prior authorization abuse. And we are an affiliate of People's Action Institute, and I'm here tonight speaking as a leader of both organizations. People's Action has 44 affiliates in 30 states, all of which focus on building community power for economic and racial justice. People's Action is a committed leader in this campaign, along with PNHP and NNU. And so far, 7 of our affiliates are planning to run Medicaid deprivatization campaigns. And I think that's a really exciting prospect in their 2026 legislative sessions. And we'll be working, all of us will be working alongside PNHP chapters and NNU locals. So we're really excited about that. So why Medicaid deprivatization, or MDP? I know in our state and in all of the other states, politicians are going to be looking to make cuts this legislative session. And we want to offset the harm that will be caused by these cuts. So instead of cutting services and coverage, why don't we cut corporate profits? That's a win-win for not only the people, but also the legislators who are in this position now. And so savings estimates for us at this time are between $307 million and $521 million. So that's no small amount. And we do know that Marylanders deserve better access. They deserve fewer denials, and they deserve fewer delays from prior authorizations. And from our experiences and reading and doing our own research, we know that MCOs love to pocket those per month, per member payments that they receive. So there is that perverse incentive. I love that line from the white paper to delay and deny care. So in 2019, we know that Anthem's Maryland Medicaid MCO had a 26.8 prior authorization denial rate, which is just unacceptable. So here's our vision. We want to return to a fully fee-for-service system. And I say return because the original state of Maryland Medicaid and so many other Medicaid systems is fee-for-service. And we want to end the 9 MCOs that received $7.5 billion of Maryland Medicaid funding in 2024. And I just think the fact that there's 9 MCOs alone, that's a lot of coordination. All 9 of them we would like to eliminate from our system. And we want to create a system that's not centered around private insurers. It's centered around providers who will lead the coordination of care. And providers know best, not private insurance companies. For the over 1.5 million people in Maryland, 1 in 4 Marylanders who are enrolled in Medicaid. So Medicaid touches the lives of so many people, whether they are on Medicaid. I have been on Medicaid before. It was a great program in Maryland, or they know someone that's on it. And our goal here is to strengthen community power. We can't lose in this situation because whatever happens, we know we're going to do that. We're going to grow our base. We're going to expand our coalition. We're going to build more legislative influence just due to the interactions that we're going to have. And we're going to shift the narrative nationwide from private insurers know best to what we do know. That's going to position us for more wins in the future. And so some of the goals of our campaign: first, we want to increase the base of our supporters. We want to get more people involved in what Progressive Maryland is doing. And so we look at this as a way to do so. And I'll talk more about how we're going to do that in just a little bit. We want to identify and develop new Medicaid leaders. We want to get more people involved in Medicaid policy, understanding it, so that we can continue this fight. We want to deepen relationships with our base and with our allies, and grow those relationships and really use the connections that we currently have. And we want to shift the narrative, as I've mentioned. We are better off with a public system that is not based in profit, and we want to build power and increase the power that progressive Maryland has. So I want to give you guys some more insight into the planning process. Very recently, just a week ago, Progressive Maryland held a one-day planning session where we established our strategy. So just in one day, I believe it was 5 to 6 hours, we did a lot of great work. First and foremost, we established the team consensus that MDP, Medicaid deprivatization, was the way forward based on our team's vision. And I think multiple things can be held at one time when you're doing this work. We can have our national strategy. We are always going to be pushing for universal single payer healthcare, but at the same time, we look at this as a stepping stone towards that. So agreeing that we can do all of these things at one time, and MDP is one of those things we really want to do. We created a plan that was grounded in community power and established who our allies are. And one of our leaders did a great power mapping activity where he put images of legislators that we know of, who are potential allies, and thought deeply about what they can do, how we can collaborate with them, and how we can use our relationship with them to push this forward. We built a campaign infrastructure with defined roles for each team member. So we did some brainstorming work and then allowed team members to decide, okay, here's what I'm interested in based on my skill set and based on what skill set I want to grow. So I think defining that was really important. And then we designed a campaign to grow the movement. So we emphasized the base to increase, using the base to increase long-term capacity. And then we built a realistic timeline around session deadlines for our upcoming legislative session. So I'll briefly just go over some of our team roles and the way we broke it up. So we have our legislative team, and we've hit the ground running as far as drafting bill language and using existing resources that we know we have. It's been mentioned Hawaii, using their legislation as a blueprint has been really great. Using the white paper has been something that we just keep going back to. And then, so we're drafting that bill language to prepare that to be handed to our Department of Legislative Services. Scheduling and conducting meetings with key HGO and finance members. So that's something the legislative team will do as well. And then preparing testimony and monitoring hearings. So those are things in the farther future. And then our narrative team is currently working to develop a campaign name. And something that we're really excited about is the idea of reclaiming. I use that in my title, and that's something that we've been talking about a lot. Taking something back that's been essentially taken from us by the private industry. Coming up with a slogan and a core message. And then they will be creating talking points, scripts for the field, and then they're going to be collecting stories and crafting narrative frames to counter myths that we often encounter and then build public support. And then we have our base building team, and they're going to be launching and promoting a Medicaid story survey, which we'll be pushing out to various communication networks, whether that's social media. And some of the leaders on our team have found that it's really effective to use surveys to gain stories and get contact information of people who could be potentially used as a part of our base and join us in this work. So prioritizing that, and then we'll be recruiting volunteers through phone banking and canvassing. And our goal is to identify Medicaid enrollees who can share their stories. And it's been mentioned previously about the experience with these MCOs and how what you see is not what you get oftentimes. So talking to people that have had that experience, and then actions and events, or planning and executing major actions and organizing turnout for hearings, rallies, and briefings, and supporting visibility actions. So making sure people are aware of the work that we're doing and getting involved. So as far as our timeline goes and what that looks like, in November, we've had our strategy meeting just about a week ago. So for those who are thinking about this for their own organizations, this is a timely thing that can happen for you all right now as well. And then we immediately began drafting our bill outline. And we will be meeting with Delegate Woods, a delegate in Maryland who will sponsor the bill within the next week or so, to brief her on this and get her support. And then we will submit a draft to DLS, the Department of Legislative Services. And then at the same time, our narrative team has begun messaging and campaign. in developing a campaign name. In December, we're going to begin our ally meetings. So those allies that we've identified, we're going to begin recruitment. So reaching out to people that we know who could potentially be interested to get them involved in the campaign. We're going to launch the Medicaid survey that we mentioned, that we'll be using on social media and other communications platforms to get stories and get contact information of those who are interested. And we're going to be having phone banks, engaging people who could potentially be a part of our base. And then we'll continue to brief our chapter and then meet with those allies in the HGO and the finance committees. And then in January, we'll be base building, again, canvassing, calls to survey respondents, so utilizing that survey, ongoing meetings with allies across statewide organizations, and then session will begin for us in January 14. And at this time, we'll always be having weekly meetings to make sure all of the teams are on the same page and filling each other in on what's going on, and what the various efforts are. In February, the bill will be introduced and we'll have our lobby night where we'll meet with legislators. And that's always a great, exciting night for us. And it allows us to get connected with various allies who have been with us throughout various stages of the journey. March, we'll have the crossover of the bill, and then end of session will be April. So that's a rough look at our timeline of how we'll approach this. And I'll leave you all with this of why we think this is possible. We started with internal issue education, and I think from my own experience, this topic can be a little bit like wonky is a term I'll use, but I think breaking it down for truly what it is, which is, again, private healthcare industry pocketing public money for their own use. So we started with internal issue education around that. Use the white paper, which has been a great resource, model legislation, and other resources to build a baseline understanding and for everyone to get on the same page, which was a really fun and great process. And then we're building off of the momentum that we have, and many of you have this within your own organizations of spring and summer campaigns that went really well, that people really got excited about, especially amidst these recent cuts. So building off that momentum, reaching out to people who we were able to be in contact with at that time. And we were able to draft a really strong bill outline in under a week. And I mentioned those other states that have already done this work. So using them as a model, Hawaii is one that really just sticks out. It was a great piece of legislation. And so we were able to use that as an example. So there's no one has to start from scratch or ground zero. And then we utilize relationships. So people's action, the leaders in people's action have been incredible. So reaching out to organizations that you are affiliated with to support this. We've learned so much. I personally learned so much about the art of organizing through them. So it's been really incredible. PNHP and all of the work that you all have already done and all of the resources that exist. And then all of our infrastructure to move this forward. And we know, regardless, our purpose goes beyond just passing legislation. We're planting the seeds for long-term structural change. And base building is underway. So regardless of what the outcome here is going to be, we know we're going to build up our base. We're going to bring in new fired up volunteers. And we're going to connect with more people who have stories to tell. And so regardless of what happens, just getting those stories out and bringing them into our coalition is a win in of itself. So you can't lose in this pursuit, and it's certainly worth it. And if you have any questions and there's any way that Progressive Maryland can help, please do let us know. So thank you all for this opportunity to share, and I will pass it back.
All right. Thank you so much, Emily. We have some time now for questions, so please continue to put those Q&As, questions in the Q&As, and we'll answer as many as we can. I'm going to invite all the other speakers to join me so that we can discuss some of these questions. And we'll start with the first one. What states have deprivatized Medicaid, and how have they won that campaign? So anyone able to share some information about the broader landscape?
Yeah, Emily, feel free to jump in. But my understanding is, as of right now, Connecticut is the only one that currently has fully deprivatized Medicaid and still is deprivatized. There have been a few states that have deprivatized and then gone back. Minnesota's on their way there, and I think Hawaii is also on their way there.
Yep, agreed. Connecticut's the one that comes to mind for me too.
True. I had a question about how long did it take Connecticut to develop and implement the admin structure to take the place of the Medicaid managed companies. So how do they kind of replace that MCOs with the state having an admin structure?
I'm going to be honest, I don't know the answer to that question. I see that Sheldon is on this call, and Sheldon was like a huge part of that movement. So if Sheldon could answer that in the chat, that would be awesome.
Great. We do have a lot of information about the Connecticut campaign as well in our report. And I believe the report has been shared in the chat, and you can find it on our website. So there's plenty of reading material there to kind of learn more about how they did it. And we've had some wonderful example of how Maryland is preparing to do it as well. So I think we can kind of use these examples to build up an effort in our own state. Another question I have here is who are our opponents for this? Is it insurance companies, ultra conservatives? How do we actually respond?
I would say for me, initially my first knee jerk is going to be, yes, the insurance companies, any MCO that is a part of the states that they are in Medicaid program. And they do work closely from my experience, and something that we're prioritizing is attending meetings that are there. So there's meetings in majority. I know this is a federal regulation and a state as well. They have to have meetings where the state and the managed care organizations communicate out to the public what they are doing, what any new changes to waivers or things like that. So they do work really closely hand in hand with each other and are very entrenched in Medicaid programs. So I would say those are an initial opponent. But with that being said, I think this, like for example, with Maryland Department of Health, I think that they have their own issues from my understanding with having to manage 9 different MCOs. So I think that they are not immediate. They're not immediately going to be against us. I think that they can be turned around through education, but the MCOs I would definitely say are number one opponent.
And I just want to add, like, because I think in that question there was something about ultra conservatives. And at least in my experience, like nobody's having a good time on Medicaid. Ultra conservatives are not having a good time on Medicaid. Ultra progressives are not having a good time on Medicaid. So it's not about party lines.
True. And I think if you really build a base and coalition and really get the support of your communities, it'll be hard for legislators to actually deny so many people demanding this change. Which brings me to our next question, and I think our last question. How can we build alliances with local groups to move this issue forward?
I think just taking a second. So as far as building alliances goes, I think this is something that really has worked for us is as a group getting together and thinking about who your allies are and what commonalities you may share. So I think getting in connection with those people, and I think just a baseline of understanding of being able to quickly share, okay, here's what we are trying to achieve and here's why it would be really great for our state. So getting clear on your messaging and then making those connections are things that I think are really important.
Yeah, I would just add, I think there have been people fighting to protect Medicaid since its inception and just looking for those coalitions or groups of people in your state that are doing that work. And I think, you may already be in contact with those folks or in solidarity with them, but just remember that there's a whole healthcare justice community in your state that would probably want to know what you have brewing around this because it's a really good not only concept but a like winning argument and will just bring a lot of people material gain in their lives and I think you can reach a lot of people with this, but just know that there are already groups that are in the fight and just look to them first and I'll also say all the unions that represent healthcare workers, nurses, they want to be in the fight too, so look them up.
Great, thank you so much. Yes, we have plenty of partners in the local level, and all it takes just reaching out and working together. So we got to do that work of just thinking up who's nearby, making that outreach, and trying to meet on that similar front. Well, I think we're going to move on. Now that we've heard about the dangers of Medicaid managed care for patients and hospitals, but also how much states can save from removing them and how Maryland and other states have taken on this work, we will now hear from Dr. Winnie Lin, a pediatrician in Chicago, on what you can do.
Thanks, Karita. So in about 6 weeks, state legislative sessions are going to start. And legislators are going to have to start contemplating those alternatives we've been talking about. So cutting healthcare, cutting other services, or what we want, which is getting rid of these insurance companies. So many states have short legislative sessions, like anywhere between 3 to 6 months. So our moment is now, and depending on what state you live in, you may have more or less time to take action. So it's good to look into what the schedule is for your state. So now we want to hear what you are willing to do about this. And in a moment, there's going to be a poll that you'll see on your screen. So what will you do to help this campaign? The options, and you can pick multiple, are I will work with my PNHP SNAP chapter, People's Action Affiliate, or NNU Local to organize a campaign to cut the middlemen out of Medicaid in my state. Share our one-pager with 5 colleagues or friends. Send the PNHP report to my legislator. Write an op-ed or letter to the editor. And ask other organizations I'm part of to support this campaign. So take a couple minutes to think about what you're willing to do. And while people are filling out the poll, I'm just going to share an example of my experience with Medicaid MCOs. So I am a primary care pediatrician at a federally qualified health center on the south side of Chicago. Almost all of my patients are covered by Medicaid MCOs, and I am so grateful and fortunate to work at a clinic that accepts all plans. However, that is not the case for the closest hospitals to my clinic, which are where my patients need to go for their subspecialty and emergency care. And so it's really common for my patients to go to the closest ER for a broken bone. They get an x-ray, they may get an orthopedics consult, their bone gets splinted in the ER. And then they're told they need to follow up with orthopedics within 2 weeks. But they can't follow up at that same hospital because their Medicaid plan is out of network. So then they're coming to me to get a referral to an in-network orthopedic specialist. And oftentimes the closest one with availability and the time frame they need is 20 miles away. And 20 miles away may not seem like a lot if you have a car and you live outside a major city, but we're talking about the city of Chicago, where many of my patients don't have cars. And the hospital that diagnosed their broken bone is only like 1 or 2 miles from their home. And now they have to pass 4 other major hospitals just to get to this orthopedics appointment. And so the restrictive networks of these Medicaid MCOs lead to lack of continuity of care because patients are going to different places for their primary care versus their emergency care versus their subspecialty care. And that means waiting for external referrals to go through, medical records and imaging to be sent over, transportation to be set up. And all that leads to delays in care. So for a child with a broken bone, if they don't make that orthopedics follow-up in time, that can mean poor healing, prolonged pain, reduced function, complications that could lead to repeat ER visits or even surgery that could have been prevented, longer time they're missing school and sitting out of sports and activities, and their parents are losing time from work and losing wages. So deprivatizing Medicaid, one of the many ways it would benefit my patients is that it would make a huge difference in being able to do their follow-up at their neighborhood hospital as long as they have Medicaid, which would remove those barriers of transportation and delay of care. So thanks for filling out the poll. Let's see what you are ready to do. Wow. Okay, so we have kind of an even split between most of the options. So lots of people willing to do the great work of organizing campaigns, and plenty of people who also want to spread the word to other organizations and colleagues and legislators and right. So this is an amazing split, and thank you all for being willing to step up. And just to help you all out, People's Action has put together a guide that will be linked in the chat. PNHP also has a lot of materials on our website that you can use to guide your actions, and it'll also be sent out to people who registered for this webinar. So lots of help. You're not alone in this. And with that, I will hand it back to Krita.
All right, great. That's really exciting. I'm glad to see so many people are willing to act on this issue. As Winnie said, this is our movement right now to demonstrate what can be achieved if we take the profit motive out of healthcare. And if each one of you on the webinar today joins the effort, you can radically transform Medicaid coverage for your most vulnerable communities while paving the path for Medicare for all. So now is the time to be connecting with your fellow PNHP members in your area, your local healthcare justice partners within People's Action and NNU to really push profiteers out of Medicaid. We have wonderful resources as shared by our speakers, as well as will be available on our website at PNHP. So take a look and start organizing. While there is a tight turnaround required for legislative action, the heavy lifting has been done and your goal is possible. Your advocacy, no matter the outcome, will begin to really raise awareness of how much we are wasting on private insurance middlemen and hopefully start to change the minds of our community and policymakers. So the most any of us can do is try. I want to thank all the speakers, SNAP, thanks to SNAP, National Nurses United, and People's Action Institute for co-sponsoring this webinar, and all our wonderful speakers and everyone that was able to join us for this webinar. I want to thank everyone for being here. Have a good night, and I'm looking forward to all the great work that we will be doing.